So now I have got my needle here. I want everyone to be sitting to this side so that I can see you performing. So on this side of the needle. So that way. So that yeah. Okay, for your needles. Now it's always safe and preferred and efficient and good to use a mask. Alright? I always have two masks. One stays in my bag and one is at my home. Okay, you never know where you have to use it. I don't say that mouth to mouth is not effective. We never say that. It is equally effective. You can save the life of the patient. But do you want to give mouth to mouth to a stranger? No. Being a nurse, I will never do that. Yeah. Okay. It's your family, your friends. I will jump into it where I know that they do not have any medical conditions. But where you know that they can have medical conditions, you will never do that. Okay, because I had a student last week in my class, and he was, I think he was a professor or something, and he was saying that I gave CPR to a patient, right? And what I did was, when I saw that patient slumped over, I checked the breathing, and I started doing CPR for them. I didn't have my mask, right? And he kept on doing his CPR thing. Now one was there when they were assessing the patient. When they pulled up the sleeve, he had multiple punctures. And when they did the test on that patient, he was a patient of hepatitis C. Oh. All right. So that professor was under observation for 8 months. He had to take continuous tests, medications, and everything. So never ever jump into situations where you're not sure. Just make a call to 911 and wait there. Even if they ask you that why didn't you do that, tell them I didn't have a mask. They will understand that because they know how it goes. Okay? Yeah.
What the certificate do we get? Home or no?
No, in the level 1 you don't get it. All right. If you do level 2 or level 3, you will get it. It's just a mask that you get it, but not the other stuff.
But where do you get the mask?
You can get it from the stores where you get medical equipment. You can get it easily. Okay. You can get it from here. Yeah, you can get it from here.
How much?
For free?
So it's for 15. It's expensive. It's $15, $16. Something like that. Yeah. Yeah.
Okay.
It's worth saving the life of a patient, guys. Right? Yeah.
Also, if you have like the naloxone or
Naloxone
kit, they have the little bag one.
Oh yeah, I've seen that, but I'm not sure how much effective is that because
it just covers the mouth, so like you don't have to make your.
Yeah. So that's safe. That's safe again. Mouth to mouth equally effective, but it's effective. Why it's effective? Two things. First things first is the valve that it has in it. This, if you see your mask, it has a valve in it. Yeah. In the yellow ones, they have the yellow one. The white ones, they have the white one here. This is a one-way valve mask. If the patient throws up something, it's not going to come to my mouth. Okay, just my breaths are going in. Anything from a patient's mouth is not going to come to my mouth. Second thing, when you're giving mouth to mouth, you're doing this. Okay, you're pinching the nose. Okay, you are just pinching the nose here, and then you're giving the mouth to mouth, right? Mm-hmm. But with the mask, you will be covering the nose and the mouth of the patient. So more air is going into the lungs from the nose, from the mouth. It's more effective. Okay?
Yeah.
So just make sure you're using it. Just remove the gauze from your doll's mouth. Okay? Just and now with the pointed part, this pointed part goes to the nose, and this curved U part rests onto the chin, just a little up off the chin, and not too low, because if you place it too low, the air is going to leak from there. Okay, so just place it here. Now, if you guys see me here, okay, so from up here with the right hand, I'm just going to seal the sides of the mask. I'm not going to do this. Okay, so just look at this one, and then I'll tell you how to perform it with yours. Okay, so just seal the sides of the mask with your hand. From down here, you can either do this or you can do this. It's up to you. Okay, either way you feel comfortable. For me, I feel this way. It's comfortable. It's comfortable for me. And then if I'm trying to blow air, you see my needle's chest here. Do you see it rising?
Yeah.
It's not rising.
Yeah.
It's not going to rise because I'm not doing this. I'm not doing the head tilt and chin lift. My patient's tongue is blocking the airway. Okay, so I have to do the head tilt and chin lift, and if now I try to ventilate her, do you see the chest rising?
Yeah.
Okay. Now try to ventilate your patient. Okay.
How many times?
How many times? Just keep on ventilating because I need to see the chest rising in all the any dolls.
It returns back.
Is it rising? Did it rise? Go ahead.
Wake up, bro.
Not working.
I don't know why it's not working.
It's not working. See, your mask is not placed right now. Now try to ventilate it. Now it's working. Okay? Guys, you guys are saving someone's life right now. How did you laugh?
I'm breathing so hard, it's not working. Like, I'm doing everything right.
Do you want to change your antidote?
Yes, go ahead.
Mine's not working.
Hindi nga.
Oh, ikigil. Kira-kira tayo. Ay,
Hey,
ikigil.
don't do that. You're breaking her ribs.
Oh man. Don't die on me, bro.
Why you said
Because it doesn't work.
now try to ventilate. Go here. See that? Okay guys, let's practice the first one, okay? So now I'm going to perform the first practical. You have to see and then you're going to perform by yourself, okay? Now I have found now we have a scenario here that Annie is found slumped over in her office. No one knows what happened to her. She's just found slumped over, and she has been carefully put down onto the hard floor. So always make sure for CPR the patient has to be on hard floor. She's the only one, and scene is safe, just one patient. So I'm going to help her out in a full crease, and I'll be breaking it down for you. Hey Annie, can you hear me? I know first aid I can help you. Hey, can you hear me? Can you hear me? She's not responding to me. Justin, just make a call to 911 and tell them that the patient is not responding to me, and please report back to me. Okay? 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000. She's not breathing. Justin, just update 911 and tell them that the patient is in cardiac arrest, and please get me an AED stat. Okay?
Hello 911.
Cut the clothing.
Patient is unresponsive. We need an AED.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. Air goes in, airway is open and clear. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. 20, 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 2, 3, 4, 5, 6, 7, 8, 9, 30. Right, so you have to keep on performing this one, okay? 30
Yeah.
chest compressions to 2 ventilations, right? So first things first, what I'm going to do is I'm going to see if my patient is responding to me. Even if my helpers have told me that she's not responding, I have to still check it by myself. When I see that she's not responding, my first 911 call now. I'm not going to tell I check breathing. So Justin is going to make a call to 911. Patient is unresponsive, so 911 is on phone with Justin so that we may confirm that if she's breathing or not. Then I'm going to look, listen, and feel to the breathing for 5 seconds by head tilt and chin lift. 1, 1000, 2, 1000, 3, 1000, 4, 1000, 5, 1000. The patient is not breathing. No breathing is equal to no heartbeat. No heartbeat is equal to cardiac arrest. And if the patient is in cardiac arrest, update 911, okay?
Yeah.
And get me an AED stat, okay? If he has an AED at job site, or he could grab it from somewhere else, he's gonna get it from me, all right? Then I'm gonna cut the clothing. We never pull up the shirt like this in a real situation because it's going to obstruct the airway of the patient.
Yeah.
We never do that. Always cut everything, okay? Cut everything. If you don't want to cut, if you are able to rip it off or like open the chest, like clothing, bare chest. Then, for the landmark, for the chest compressions, now it's really simple, guys, okay? Keep in mind. Before that, it used to be hard, when they used to tell that, okay, place your hand just above the xiphoid process, in the center of the sternum, so many medical terms. Now it's just simple. Center of the chest, between the nipples, just place your palm, make a fist, okay, like this, or you can leave your hand like this, alright, and bring your body weight over your patient's body. Your hands, your arms should be straight, okay. See my hands are towards this side, okay. So yeah, if you move this way, yeah, come to one side.
This side?
Yeah, there. Now expose the chest. Yes, there you go. Now it's the right spot. Okay, so chest compressions should be hard and fast at the rate of 100 per minute. They should be hard enough to push the chest 2 inches deep here. Okay, even if you're breaking the ribs of the patient, no problem with that. That's an effective CPR. Just keep on doing it. If you're just pressing superficial like this, you're not pushing it hard, it's not an effective CPR. It's not going to help them out. So it's going to be like this. 1, 2, 3, 4, 5, 6, 7. Okay, your hands should not be this, okay? So it should be nicely sticking to the chest. And be with me. Let's do it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. After 30 chest compressions, you will get 2 ventilations. Head tilt, chin lift, good seal with the mask. Pointed part towards the nose. Check your mask. Just 2 breaths, okay? Start the same thing. 1, 2, 3, 4. All right, perfect. You guys can stop there. Let's start the practicals now. That was a warm-up.
It's just a warm-up.
Okay guys, we're going to start the practicals. You make sure you be in the class for the practicals, okay? Because if you have to go to the washrooms and then the other people, they have to wait for you. Okay? They can't work till then. Wow. My head came out.
So uncomfortable with like I'm
Wake up,
like,
man.
this. So